This is the second video for Chapter 13, Psych Disorders, and in this video we're going to discuss schizophrenia. So in schizophrenia, we have a true split from reality. So people have severely distorted beliefs, perceptions, and thoughts. So this kind of picture here of the cat shows how this occurs. So we see somebody with a good grasp on reality, that cat in the first pane, and it gets further and further from reality, more and more abstract as this person dives into a schizophrenic episode. So schizophrenia really is this true split from what we would call reality. The symptoms of schizophrenia are positive and negative. This doesn't mean good and bad. It's a very important distinction. What positive and negative means instead is positive is kind of extra things that we don't normally have. So normal people don't hear things or see things or smell things that aren't there. So these are extra things or added things to their cognition. The negative symptoms are things that they're missing. So quote unquote normal people would have these aspects of their cognition, but with people with schizophrenia, they're missing those aspects. So this chart goes into the negative versus positive symptoms of schizophrenia. So in the red, you can see the negative symptoms. So this is stuff that they've lost compared to someone without schizophrenia. So their affect is often very flat. They don't show a lot of emotion. And alogia is poverty of speech. So they start actually speaking less, using fewer words. And avolition, we see there at the bottom with the person who's dropped the egg. Avolition is this lack of motivated behavior. So people with schizophrenia may drop that egg and just look at it and go, all right then, and wander off. They don't have that same motivation to clean their space or to do any of these things like shower or bathe, kind of lose that motivation. Those are our negative symptoms of schizophrenia. The positive symptoms of schizophrenia are in blue. So with this, we see things like hallucinations, so kind of seeing or smelling things that aren't there, as well as delusions, so having really inappropriate types of beliefs like someone's following me, someone's after me. So we see those things, and they're positive because we don't typically see those in people. So they're extras, additions to consciousness, as this graphic says. So we can get hallucinations and delusions. We also see disorganized speech patterns, so kind of a word salad, speaking very quickly but not making a lot of sense, and other forms of disorganized behavior. So what this graph shows is an incidence of both the positive and negative symptoms in about 100 people at the time they were hospitalized for schizophrenia. So we can see of the positive symptoms, the most common things that people report are delusions. Underneath the table, you can see some of these delusions. So we have delusions of reference, and that could be things like you turn on the radio and all the songs are about you, or that you live in the Truman Show and everyone's referencing you. Delusions of grandeur, which is that you're a very important, famous person, that everyone knows you, that you're the king or sultan. Delusions of persecution, which are that people are persecuting you, they're coming after you, often has to do with terrorist attacks or Nazis or those types of things. And then delusions of being controlled, so someone is actively controlling your thoughts. So most people report, or 81% of people report having some delusions. And of our negative symptoms, we see most people reporting avolition or apathy, so that lack of motivated behavior. So they just stop bathing, stop doing, maybe going to work, stop doing anything that would be a motivated type of behavior. So the prevalence and course of schizophrenia, I know this has always stuck with me when I learned this at the first, in my first psych class. It's not very prevalent, so there's not very many people, about 1% of the US will be diagnosed with schizophrenia. But the prevalence in course is very, very interesting. So about a quarter of people will recover. So they'll have a schizophrenic episode and then never have another schizophrenic episode. Another quarter will have reoccurrent episodes with little impairment. So they'll really just kind of live their life, not have a lot of issues or problems with their schizophrenia, but they will have some reoccurrent episodes, more than one episode. But it doesn't drastically impact their quality of life. But for a full half of people, so 50% of people who have this schizophrenia diagnosis, schizophrenia will for them become a chronic mental illness, and it will impair their functioning. So they may be in and out of institutionalized settings or psychiatric hospitals to try to stabilize. So it's going to be a chronic issue for them. The risk of developing schizophrenia, we know that schizophrenia has a strong genetic link. And we know that because if you map out people's relatives with schizophrenia, you can see the risk that that individual would have schizophrenia. So you can see this chart goes over first cousin, uncle, and aunt. But the big jumps you see here are for identical twins and if both parents have a diagnosis of schizophrenia. So in those two cases, we have people having about a 50% chance of having schizophrenia themselves. So if your identical twin has schizophrenia, there's a good chance that you may also develop schizophrenia. But the important thing is that it's not 100%. So we don't see this, being 98% or 100% at all. It's only 48%. So we know that there's other factors underlying the risk of developing schizophrenia. It's not just genetics. So how do we explain schizophrenia then? If we know it's not just genetics, even though it has a strong genetic component, how do we explain it? Some things that we've developed, there's been a lot of research into explaining schizophrenia. Some things that have been hypothesized, there's some support for, are things like older parental age or paternal age, which is kind of interesting because many times when we talk about different disorders, we're talking about the mom. But in this case, with schizophrenia, it's really the dad, the paternal age. And we think this is maybe due to some mutations in the sperm. There's also a lot of evidence to suggest that viral infections, such as flu exposure, early on in pregnancy may contribute to the risk of developing schizophrenia. We also know when we look at the brains of people with schizophrenia that there are some abnormal brain structures. So we can see some enlarged ventricles, loss of gray matter. It's hard to say, though, if that's the cause of schizophrenia or it's due to having schizophrenia. But we do know that those structures are abnormal in many people. There's also some evidence to support psychological factors as being important. So people who grow up maybe in unhealthy families, maybe they already have the risk for developing schizophrenia biologically, but then grow up in an unhealthy environment. And we also believe that there is some evidence for excess dopamine in certain areas of the brain. And this is also supported by some research with drugs that will sometimes cause delusions or hallucinations, and we know drugs impact our dopamine system. So there's some evidence that dopamine may be important here. That'll get us through schizophrenia and through chapter 13.